Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 134,294 confirmed cases of COVID-19 in Canada and 43,685 cases in Ontario. Chatham-Kent has 364 cases and Sarnia-Lambton has reported 342 cases. Michigan now has 108,595 cases, with 13,913 cases being in Detroit. Today we are reporting 2,569 cases of COVID-19, an increase of 8 cases from yesterday. 3 are travel-related, 1 is a close contact of a confirmed case, and 4 are still being investigated by our nurses. 2,413 people have recovered, and 80 people are active and being followed by our health unit. 6 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 2 retirement homes currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. As students return to school, we know that parents will have many questions. We have been working with the school boards and have assigned school nurses to make this transition back to school easier for students, parents, and staff. One of our most important messages is to stay home if you are sick. It is important that everyone conduct a symptom check before going to work or school. If you have symptoms of COVID, please stay home. Symptoms can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Please check our website for information for parents and caregivers as children return to school. We have prepared guidance for both elementary and high school students, including a quick symptom checklist to help you determine if your child should remain home due to illness. To access an assessment and testing center, there are several options in Windsor-Essex County: Erie Shores Healthcare in Leamington, Windsor Regional Hospital Outlet Campus, and the Sportsplex at St. Clair College. And SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. This morning we are reporting our 76th death in Windsor-Essex that is related to COVID-19. A man in his 60s, positive for COVID-19, passed away in hospital. Our team would like to share our sympathies with the family. Our team continues to educate and enforce our mask order for commercial establishments. We have addressed hundreds of complaints and issued many notices of violations. Masking bylaws order work in concert to protect the public when in areas where physical distancing may be difficult to ensure or maintain. As we continue to see cases in the community, public health measures continue to be the most effective way to reduce COVID-19 transmission. Next week, we will be updating our face covering order to ensure consistency across the region in public spaces and that require face covering in the region. You will see further details next week. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Yes, I wanted to ask Dr. Ahmed, you mentioned that next week we're going to be updating the face covering rules. Is there a reason why? Is it because other municipalities are bringing in their bylaws? Is it to conform to that?
Yes, so the municipalities are bringing their bylaws. Some municipalities are including spaces that others are not including. So from a public health perspective, what we are trying to achieve is some kind of consistency in common areas that is across the region to ensure that the language allows consistency in the region, so people don't have to worry about what happens if I'm in LaSalle versus what happens if I'm in Amherstburg. And just to clean it up, it won't be entirely different than what we have already. It's just to clean it up and make sure that consistency is achieved.
Are you still finding that there is some, confusion? You mentioned that you've had hundreds of complaints about masks. Are a lot of these people saying, well, I didn't know because I'm in a different municipality?
Not necessarily. Mostly there are people either inappropriately using the mask or maybe not wearing the mask when they should, and when they're reminded they wear the mask. We can understand the challenge for people wearing masks for a longer time period. Everyone is different. There are some people who can easily wear a mask for 8 to 10 hours every day without saying anything or doing anything differently. But then you have people who don't even want to wear the mask for 5-10 minutes, and then they feel differently. So I think when we're talking about these masks, let's just be very clear, we're talking about public spaces. We're talking about areas where there would be a difficulty in maintaining physical distancing. And those are the areas, those are the places where people go, do their work, and they come out. So, and there are reasonable exceptions to these mask and face covering orders in all the bylaws in the section order that we have issued from the health unit. So it covers all of that pieces. We just want to make sure that people are doing their part, being respectful of the public space, and ensuring that everyone is doing their part to prevent any transmission happening in those public spaces through source control measures. And when people are wearing the face covering or face masks in those settings.
Last question, just basically about this unfortunate fellow who died in hospital. Do we know when he got sick, when he was admitted?
I don't have that detail in front of me, but I think he had a number of chronic diseases. He was being followed up by the healthcare provider for some time, and because of the number of complications related to the individual's health, this person passed away.
Thank you.
Any questions from the Windsor Star?
They've been covered so far, thank you.
Any questions from Windsor?
No thanks.
CBC?
No, thank you.
AMA 100?
Dr. Ahmed, just a few weeks ago, Windsor-Essex was considered a hotspot for the virus. Seems like for the most part things are under control here. Are you hearing from other regions that are now considered hotspots to what Windsor-Essex is doing?
Well, I think we know that there are larger municipalities such as Toronto, Peel, or more in particular Brampton and Ottawa are already identified by our premier as the hotspot. So definitely we are keeping a close eye in our community as well. And I would say we've had our unique challenges in the region, and most of these cases we've seen almost 50% of these cases were from the agri-farm sector, and then we have seen a significant number of cases resulting in our long-term care home and retirement home that basically drove the number to a level where, unfortunately, for the wrong reason, we have the highest rates of COVID-19 in the province. But hopefully, if the trend continues, which we are seeing with cases in single digits, hopefully, the community transmission in our region will continue to decline, and we will be in a much better position where we should have been if we didn't had to face all those challenges. But definitely when we are seeing other areas becoming the hotspot, it gives us the message, and it should give the community a message that everything that we're seeing in the region, it's because of the measures that we have in place and people following those measures. And any relaxation, any changes in our not following physical distancing or public health measures could lead to a situation where we can see transmission back in the community. We can see a large number of cases in the community, and we definitely don't want that. No one wants that. It's detrimental to the businesses, it's detrimental to the society, it's detrimental to our community. So we all need to be putting our efforts together for not only to protect our economy, our social and mental well-being, and to keep going as a community. We all need that. We all need to see those numbers go down almost to the point where it's non-existent, but we can only achieve that if we continue to follow those measures.
A follow-up to Teresa. Teresa, last week you told us about 4 businesses that were issued orders for not following the mask, the face covering order. Any updates in regards to those 4 businesses? Have the health unit's enforcement officers been out there to see if they are following the bylaw now, or the mask order now?
My understanding is they have followed up, and that there's no further progression of enforcement at this time.
Okay, thank you.
Any further questions from Blackburn?
No, I'm good.
Windsor Star?
Yes, Doctor, I don't know if you'd be able to answer this question, but our region has a significantly lower mortality rate than the provincial average than a lot of other regions. Is there any way to explain that, or is it just we're lucky that our people with COVID-19 are dying from it?
Well, what I can tell you is when we are looking at the individuals who are at highest risk of developing complications associated with COVID, those are the individuals who have either underlying chronic medical conditions or seniors in the 60s, 70s, 80s. That's where we see most of these issues. Younger body can respond to the disease and can react to it even with hospitalization. They do not end up dying for the most part. And then using that information and to the link that I made, that 50% of our cases were in agricultural farm sectors. And when we are taking that agricultural farm sector population, those are generally healthy population between the ages of 20 and 40. And so those the likelihood of them recovering without developing severe disease or dying from it was very low. And that's one way to explain that why, despite the high numbers, when we're talking about the actual rates, the rate can go down, because obviously rate is a function of number of deaths versus the number of people who are impacted by it. And if the majority of the people who are impacted by it are generally healthy between the right age range, that will drive the rate to a lower level, what we are seeing in our region.
Thank you.
Any further questions from Windsorite?
No, thank you.
CBC?
No, thank you.
AM800?
Just a quick one for Dr. Ahmed. Dr. Ahmed, yesterday the health unit removed a number of businesses from the potential public exposures page. I know it says on the website that they're removed after 14 days, but do health officials, your team, have to go to these businesses before they are removed from the site?
Well, half of the answer should be directed to Mike, because he's the one who's putting all this information on our website. But the rest of the information, yes, from our inspection perspective, not necessarily. I think it really depends on the reason for putting those businesses there. Most of the time, it is happening because of the exposure. It's not necessarily because of the business practices. And again, that's what we always report, that when those exposure notification is going out, it's not a violation notification. It's not about the business not doing their job. So businesses are doing their job. That's why we are not seeing any resulting transmission from any of these establishments. So that's a good sign that the businesses are complying with that. And by these exposure notification, it's not an indication of any businesses whether they're doing good or whether they're doing bad. And when we're talking about removing that exposure notification, the purpose is to notify that that's the critical exposure period where someone, if they have visited that establishment, then if they develop any symptoms, if they have visited that, then they can monitor their symptoms and they can seek appropriate health care. When we are removing that, basically that time period has lapsed already, and anyone, if they were to develop any symptoms, either it has already developed or they have seek any healthcare need if they have. Unless there is a specific reason that was highlighted at the initial inspection when our team went out, if they flag anything that they want to follow up with the specific business, that's when they will go back. But generally speaking, when we are removing those notifications, it doesn't need an inspector to go out and verify that everything is in place at all times, because we frequently monitor those businesses anyways, and all our notifications and the history of all those business inspections are with us, and we continue to work with them.
Perfect, thank you.
Okay, thank you, everyone.
Thank you.
Bye-bye.